Hello, I'm Dr. Becca McNally. On behalf of my colleagues at Indiana University School of Medicine, I'm pleased to present our work on telehealth evaluation of neurodevelopmental disabilities during the COVID-19 pandemic. Families of children with neurodevelopmental disabilities often wait months to years to receive a diagnosis, leading to delays in accessing critical interventions. Reasons for this include shortages of qualified diagnosticians and inefficient evaluation models. Telehealth has been identified as one potential solution to these problems. The COVID-19 pandemic has provided us with a unique opportunity to test the use of telehealth for neurodevelopmental evaluation. In this study, we present clinician and caregiver perspectives regarding telehealth neurodevelopmental evaluation at the onset of COVID-19. The study took place within the Riley Child Development Center, an outpatient interdisciplinary evaluation clinic. Data in the current study was collected between May and July 2020. Children were scheduled for a 90 to 120 minute telehealth diagnostic evaluation led by a licensed psychologist. A developmental behavioral pediatrician provided consultation for children with medical complexity. Our standard evaluation approach included completion of a comprehensive clinical interview and behavioral observations, given that virtual assessment tools were not yet widely available in the early months of the pandemic. 254 children between 18 months and 17 years of age completed a telehealth evaluation during the study period. 9 licensed psychologists submitted data. 2 surveys were developed to answer our study questions. Clinicians were sent an individual electronic survey for each evaluation with items about evaluation procedures and outcomes and their satisfaction. Caregivers received a secure satisfaction survey with 10 questions rated on a 5-point Likert scale. A clinical diagnosis was provided in 72% of evaluations. Reasons that clinicians could not make a diagnosis included being unable to adequately assess the child having a complex presentation, and also family psychosocial factors such as a recent history of foster placement or trauma. In 75% of evaluations, clinicians rated their diagnostic certainty as completely or somewhat certain. We found a significant relationship between clinicians' ability to provide a diagnosis and diagnostic certainty, as well as between the specific diagnosis provided and clinician diagnostic certainty. Certainty was higher among children diagnosed with autism spectrum disorder as compared to those with developmental delay. For 19% of evaluations, the clinician had to provide technical support to help the child's caregivers access the telehealth platform at the beginning of the evaluation. Technology barriers were reported in 27% of evaluations. Clinicians reported challenges due to the family or home setup in 32% of evaluations. Neither technology or home setup challenges were associated with the ability to provide a telehealth diagnosis or diagnostic certainty. Clinicians reported that telehealth was adequate for addressing the referral question in 65% of evaluations. In just over half of evaluations, a preference for seeing the child for a traditional in-person evaluation, had it been an option, was endorsed. Overall, clinicians were quite satisfied with telehealth. Clinicians endorsed higher satisfaction for conducting evaluations of children referred for other concerns as compared to those with autism spectrum disorder or general developmental delays. Caregivers' ratings were high across 10 domains of satisfaction. Nearly 30% of caregivers reported that the telehealth evaluation saved them 3 or more hours of time as compared to if they had traveled to the clinic for in-person evaluation. Notable progress has been made in the delivery of telehealth for children with neurodevelopmental disabilities. Results of our study suggest that many children referred for neurodevelopmental evaluation can be adequately served using telehealth, at least in the context of the early months of COVID-19. We direct any interested readers to the full manuscript for further discussion of study strengths and limitations. We see this as collective progress, as a launching pad for research focused on telehealth disparities, diagnostic accuracy, including testing of novel remote assessment tools, as well as development of models that co-design telehealth delivery with stakeholders. This work will be critical in answering questions regarding how clinics can most effectively and efficiently provide services beyond the pandemic. We are grateful to the various sources of funding, as well as to the children and families who participated, the clinicians who submitted data, and to our colleagues who made this work possible. Thank you.